Okay, so HESI study guide, 3 exam study guides, your PowerPoints, and your case studies. Okay, at this point, I would only be going back to the book if you needed this. Number 1 bullet, pay attention to the chapter you didn't review or the material you don't understand. Okay, review PowerPoints. I'd probably add and case studies. I'll formally put that in there for next term, but case studies. Review exam study guides we just talked about. And then we just talked about your NCLEX questions, your evolve case studies, and I'd add Kaplan. Have prepared you. I mean, the Kaplan is as close to an NCLEX or a HESI question as you're going to get. Okay. And then your other assignments during the term, your discussion posts. Well, here's Kaplan. Kaplan questions for community is good practice. Make sure you're taking notes during the remediation of each question. The rationales are super helpful. Again, rationales. If you reviewed your exams with your instructor when the review period was open, you should have an idea of what to expect. And then important here, when we think of HESI, when we think of NCLEX, we think of nursing process. What have I said all term about your nursing process, your ADPI? What do you have to be able to do with your ADPI in this class?
Related to the community setting.
Right, CJ, whatever topic we're talking about, whether it's family assessment, environmental assessment, community assessment, it doesn't matter what topic we're talking about, you have to be able to apply your ADPI, your nursing process, to that concept, to that topic. Okay, the community HESI is very med-surg heavy, okay, because we're talking about scenarios in the community. So you're going to be definitely bringing your med-surg essential knowledge into the community HESI. And then safety, what do we mean about safety? What's the first ABCs, right? ABCs and delegation, okay? What can we delegate? What can we not delegate? So these are the principal topics that are going to be focused on in HESI, okay? And so if the way this is organized, it's in, I think, 10 distinct groups, and these groups were all covered in class. So what I've said to my previous 2 classes this week is most of this information on here, 95% of this information in the study guide should be familiar to you if you've been following along and keeping up. Okay, there may be some information in these sections that we haven't gone over in class, but it's part of the topic. Okay, so you may haven't heard, you may not have heard every word on this study guide in my class, but you've heard of all the topics. And so if something is brand new on here, look at the topic. And I mean, when I say 10 different topics, the red highlighted, all the way through here are the 10 different topics. Okay, so if there's something on here that I haven't said during class, it's still within that major topic, and you still need to know it. So, but 95% of this on here should be familiar to you, and all the topics should be familiar to you. Okay, so for example, this first topic, population groups across the lifespan. And then it's broken out into all the different populations that we talked about. Okay, infants, and I'm just going to go through this. I'm just showing you how this is organized. Okay, because I don't want you to think that this is another 56 pages in addition to what you have to learn. This all this in here, you should have already learned. Okay. And that's why it was meant to be given to you at the beginning of the class, so that if you went through every couple of weeks and highlighted, well, I know we went through populations across the lifespan, but I didn't really catch a certain part and I need to go back and read about it. Make sense? Okay, so we broke down population groups across the lifespan into infants, children, adolescents, women, men, and the elderly. Okay, and we talked about all of those groups. So you'll need to go back and review each of those groups, or if there's a certain group that you feel like you need to have a better understanding on, you'll have to go back into that chapter, or go back to a case study, or go back to your PowerPoint for that particular chapter and review that. No, there's no sense reviewing 32 at this point. There's no sense reviewing 32 PowerPoints and 32 case studies if you understand the material. Does that make sense? You should, at this point, you should be going back and reviewing them if you need additional understanding, additional knowledge. Okay. And then at the end of this section, there's a couple of statistics about US healthcare populations. Talks about the uninsured. Okay. And in this section, we also talk about home visits. Okay. How do we do home visits for, why is it important that we know the difference of how to do home visits for all these different populations? Because our teaching and our interventions may be different for an infant visit, newborn visit, than it is for an elderly visit. Okay, and that comes up a little bit later in this study guide under specific types of nurses in the community. And then obviously right off the bat is the levels of prevention. A lot of the questions in the HESI, what we're finding, what we found, are based on knowing secondary, primary, secondary, and tertiary. And along with being able to apply your nursing process to different topics in the community setting, what is the expectation with your levels of prevention? As far as you say, it's the same thing, same thought process. You have to be able to identify what a primary, secondary, and tertiary level of prevention intervention is in all the different topics. Right. So what a primary prevention may look different with a group of kids talking about obesity versus elderly clients talking about falls. Okay, so you have to be able to apply primary, secondary, and tertiary to all of your different community topics. And this is a good box. It came from one of our chapters about the difference in the three. So what's primary?
Education, stopping it before it ever happens, basically, a issue. So
Yep.
could be also vaccinations.
Yep.
Or for a, I wanted to ask for the pregnancy, because the way that they looked at it yesterday is like based on the stage of pregnancy. So like a primary prevention for a healthy pregnancy, would that be education on eating well before you get, okay.
Yeah. Yeah.
Yep.
What about secondary? What's secondary?
Screening or preventing any further complication from potential or noted illness or something.
Yeah, and so what I like to call secondary is early identification and early intervention.
I like early identification and early intervention.
Yeah.
Okay.
Tertiary. What's tertiary?
You already are like within, so you're just preventing it and like curative or trying to get back to your optimum level of health. before illness.
Yep. So your tertiary is your words that I like to use to describe tertiary interventions are management of your disease, of your issue, rehabilitation. You're trying to get back to whatever the new normal is. Okay. Okay. The next section, so this would be number 2 is specialty nursing. So what have we covered over the term as far as different types of specialty nursing within community? We have covered school nursing, right? We have covered faith community nursing. We have covered hospice and home health. And I added one the other day, yesterday or Wednesday, was occupational. And that comes up at a later time as far as occupational nursing in the study guide, but I just wanted to add that we cover. So we covered all these kinds of nursing, right? Does everybody have a recollection of that? Okay, so go through and read through each of these sections and understand what each of these roles, what the difference in all of these roles are. Okay, if you have questions or you don't understand that section, you'll need to go back to PowerPoints, case studies, the book if need be, to understand the differences. Okay, but you should have a basic grasp of what all these different roles in the community we have. Okay, and then in general, what is the role of the nurse? Okay, well, that depends on a few things. And you know me, I like to highlight everything. So, or highlight what I'm stopping to talk about. That doesn't mean that this is on the exam. Okay, I'm just highlighting what I think are important areas. Okay, so my highlighting in no way means that you only have to read the highlighted section of that part. Okay, so just full disclosure on that. So what is going to be our general role? Well, that depends on a few things, right? It depends on what the health problem is. It depends on what the community's decision-making ability is, and it depends on professional and personal choices. And there's many other factors that will go into deciding what our role is in a particular situation. Many factors, but these are the common and very important ones. Okay, and then you can read through this, but it says some health problems clearly require certain interventions. Okay, and it goes through some scenarios here. Okay, the community's history and of taking part in decision making is a critical factor. Right, different roles may be required in the community if it lacks problem-solving skills. So read through this. Okay, nurses have a critical role in the delivery of healthcare to the poor, the homeless, the mentally ill. To be effective, nurses need strong physical, psychosocial, current knowledge, respect, dignity. So this is a good section. Read through this. This is the role of the nurse. Okay, what kinds of things might we be participating in? Well, family assessment. So remember, during family assessment, we talked about the difference. Are you doing a family assessment based on a genogram or an ecomap? And what's the ecomap? What's the difference without looking at this? What do you guys remember? Anybody remember the difference between a genogram and an ecomap? And why it's important to use either one of those? Okay, well, then have a look at this. But these are two models that we use for family assessment, and they're very different. Okay, our role is also prevention strategies for violence in the community. So you can read through that. how we do our assessment at the individual level and the community level. And here's a list of what our roles might be when working with vulnerable populations in the community. Okay, and we even give a page and a box number to go back and look at as far as all these roles we might play. In the rural community, you might be doing all of this. Okay, how do we assess incomes with regards to poverty? Section here. As nurses in the community, we're going to be dealing with financial issues. We're going to be dealing with legal and ethical issues. We went through all of this during class. Okay, 4 major healthcare functions of the federal government: direct service, financing, information, and policy setting. And then we also talked about professional negligence, malpractice, as we're practicing. Okay. Here's your ethical principles you can review. Next section is program management. How do we develop programs in the community for our populations? What's the very first thing we have to have an understanding of before we do any program management?
Who we are teaching, so an understanding of the population, whether or not they're like old or children, or, and then what, and also it's, I mean, of course we're gonna model it like making a care plan, right? So
you have to be able to
also
go
being
ahead.
aware of what you are able to provide, and also potentially needing to like change your teaching style to, like, if it's a group of kids, then it definitely needs to be different than if you were teaching a group of elderly. So identifying your own quote bias or where you are before you begin, and then the way you're going to deliver it as well.
Yep.
Also
That comes up in, yep. Thanks, Alex. Excellent. That comes up in a little bit here with program development, is how do you be an effective teacher? How do you evaluate your program? How do you, well, think of the ADPI. How do you do your assessment of what the needs of the population are, and then just go through your ADPI. Plan a program based on the needs, identify goals, objectives, right? Go through your ADPI with program management process. Okay. I highlight this because I think this is a good, summary of primary, secondary, and tertiary. Right? Prevent disease, primary, secondary, and intermediate level of health that includes diagnosis and treatment, screening, early identification, early intervention, and then tertiary rehabilitation and return of the patient to this status of maximum usefulness, minimum risk. Okay, here's your aspects of program evaluation. If we're going to start to look at how we evaluate programs, here are the key terms that we use during the term when we talked about this. Okay. Evaluation outcomes. Most of the program development in the chapter that we studied was based on outcomes. How do you evaluate? How do you develop a program, and how do you evaluate outcomes? Okay. Next section is infectious disease. So again, I hope that, just kind of stop and do a check-in here. And I'm looking at everybody's names. I don't really only see a few people. It's only Kate. Hey, Kate. It's only you and I. Everybody else. Is this helpful to go through it like this? Because I want to show you how it's broken out, because these sections we've already covered during class. It's just, I'm just trying to organize it for you so you're not so overwhelmed looking at this big booklet. Is this helpful? I'm doing a check-in here.
I appreciate it when it's this way, yeah.
I think it's pretty helpful just to review it all.
Yeah, I mean, and that's kind of where we're at now. This is a review. All the learning should have taken place, right? And if there's areas that we're going through that you're going, I need more information, I need to study this more, highlight that on your study guide. Okay, next section is infectious disease. What's this here? Do you guys remember what that is? The agent, the host, and the environment? What is that? Anybody?
Epidemic triangle.
Epidemiological triangle, right? So we need to know that. Okay, so study this on your study guide. Everybody's pretty quiet this morning, so I'm not really participating, so I'm just going to go kind of through this quickly. Epidemiological triangle is the agent, the host, and the environment. Okay, the web of causality is all those interrelationships with regards to the agent, the host, and the environment. Okay, CDC reportable diseases. You don't necessarily need to know everything that's reportable, but you do need to know that that there are reportable diseases, infectious and communicable diseases, and how to go about doing that. TB is on here. Now, I know I didn't cover TB in specifics in class, but it is on your study guide, and we have found it to be questions, or there are questions about TB on previous HESI, so we need to take that into account. Okay, there's a whole page on exposure to TB, testing, how do we test, how do we interpret it, what's the follow-up? So understand that. Okay. Anthrax. Okay, there's a section on here. Okay, and that's on here because based on our research of HESIs in the past, anthrax has come up, radiation exposures come up. Then the next section is go through this disasters. We found lots of information, lots of questions on disasters, or at least the topic of disaster. Let's see, we go from page 27 all the way through 27 through 37, so 10 full pages of this study guide is disaster, preparedness, disaster. What are the four stages of disaster management? Anybody know? Think of the nursing process. What's first?
Evaluating what's the situation. Gosh,
Well,
it's so hard when I don't have my notes up right in
That's
front of me.
okay. The very first process is prevention.
Oh, that's
Right?
right.
Very first process of disaster management is prevention. Right? And then what do we have? Preparedness. Then the actual disaster, and then the recovery. Okay. Response is the third. So prevention, preparedness, response, and recovery. And this goes through all of this. These 10 pages go through those four parts of disaster management. So definitely have a look at that. Okay. And then the next section is culture. We talked a lot about culture. Why is cultural competence critical in our practice? What are the pros and what are the cons of being culturally competent? That's a question. So if anybody wants to jump in and answer that.
I don't think there are any cons to being culturally competent, but pros
No,
would just
what I
be-
mean is what happens when you're culturally incompetent.
Oh, okay.
Yeah. yeah.
Well, yeah, you're not able, it's
Mhm.
the exact opposite of being, all the benefits of being culturally competent. You're a better nurse, you're a better caregiver, you're better able to understand what the needs are of the people you're taking care of in a way that they're able to accept, because people can accept care better when they're feeling like you understand how to care for them.
Yep. And what may be some barriers to not being culturally competent?
Our own bias.
Yeah.
Or just ignorance.
Yeah.
Being closed off to other cultures
Mhm.
can pose a risk of like problems. You could offend them before even knowing you're being offensive. Maybe they need to tell you about something that was crucial to their survival or something, and they couldn't now.
Right. And we talked about this. What's the most important thing to establish right off the bat?
Your own bias and your own culture.
Okay. And trust. Remember we talked about that? Working with anybody, whether they're from a different culture or not, you have to establish trust. Okay, so this whole section of culture goes through cultural competence, cultural incompetence, and then how do we develop cultural competence? Okay, there are certain cultures. Do you remember that that box in the cultural competence chapter that talked about different cultures and some of their practices based on communication, based on space, personal space, time perceptions of a future oriented, present oriented. Do you remember all that? And then here's cultural competence, right? And the 10 standards of 10 standards are based on the principles of social justice and human rights. And I highlighted this because I felt like it was important. Nurses must be culturally competent for several reasons, and we just talked about that. We talked about some of the issues. The client who doesn't feel understood may delay seeking care. Okay. How do we develop cultural competence? 3 stages of developing it. Okay, so we went through all that in class. That should be a review. And then the next section was rural versus urban. This is the section where immigrant, migrant care is discussed. Okay, what are the health status of rural residents? Okay. Why are rural residents less likely to seek care?
Farther away.
Because, oh yeah, go ahead.
Go ahead.
No, sorry.
No, go ahead. Said Alex, go ahead.
Yeah, sorry. Farther away, less knowledge about caregivers, or they also think that the caregivers are judgmental.
Mm-hmm. CJ, you want to add to that?
I was just gonna say, like, maybe language barriers and things like that. It's hard to understand, and if I wouldn't want to go to somebody if I feel like I can't understand them.
Right. And then thank you, both you guys. And then remember, we have lack of access in rural, some lack of specialty care.
Oh, did you say rural? I'm sorry. I thought you had said, I'm sorry. That sounded dumb for me to say that then. I was thinking of not rural. I was thinking of like the population of people who like are not native to here.
No, but that's part of this discussion as well, is what are the challenges in the rural community? So yeah, I mean, everything both you and Alex saying, those are struggles up in the rural community: lack of access to specialty care, lack of transportation, language barriers. What other issues do we have in the rural community? Why do, here's another question that we covered. Why do the rural population, why may they be less likely to seek care? What was that?
Less trusting.
Yep. And what was that big word we used? The lack of anonymity.
Oh, that's right. Yeah.
Remember that?
Yes.
What?
Their ones are small, so they're afraid that everyone's going to gossip about what they're doing.
Right, which leads to big problems, because when we really do have issues, we want them to report, such as violence and domestic violence and abuse, and they're less likely to come forward. And when do we finally see them? When it's reached a crisis level and they're in the emergency room. You guys remember that part of remember that during class? We talked about that. There was a question on the exam about that.
Is it true when they were talking about, I think it was you and Professor Solowski were talking about there being programs implemented to become a rural health caregiver, whether it be a nurse or NP or a doctor? Do you see these in Denver as well? Or any?
Well, I know there's, I mean, I told my class, I mean, if you end up being a rural community nurse, public health nurse, you are bringing in everything. You are bringing your peds experience, your med surg, your OB, because you will probably be wearing most of those hats and traveling from county to county. Does that make sense? Is that what you're asking? I mean, rural nurses are, there's so much more, I guess, what am I trying to say? There's so much less oversight and so much more independence in a rural nurse versus, a nurse in the city working in the hospital. Does that help?
Yes, I really like being able to use all your knowledge. I like the sound of that.
Yeah. Well, you're going to get that, and if you're working in the rural areas, yes. In this section, we also cover the migrant farm workers. Please know the characteristics of the farm workers. What's their lifestyle? What may be their issues in health? Remember, this is the chapter we covered the difference between migrant health and immigrant health. Alex, here's a good list for you. Well, for everybody, but nursing care in the rural environments. Here's all the things that you might be involved in. I mean, that's a big scope of practice, And then there's some next section is the federal agencies that you need to know. You guys can go through those. Community assessment. I think that might be the last section on here. Most nurses are familiar with the nursing process as it applies to an individual. Okay, but utilizing the nursing process to promote community health now transitions the process to a community-focused nursing process. Okay, so all that verbiage in that little paragraph is that we need to be able to apply the nursing process when we're community nurses. And how do we do that? How do we take our nursing process and apply it to a community assessment? Identifying the needs, right? So community assessment, the process of critically thinking about the community. And you need to get to know the community. How do we do that? Right? So your community assessment phase involves a logical, systemic approach to the initial phase of the nursing process, which is assessment, right? Identifying the needs, identify strengths and resources. Okay. And this section goes through how to do a community assessment. That should be reviewed to you. We talked about community assessment, windshield survey. Okay, and here's my trust statement. To effectively reach a population group, you must connect with somebody in the community and establish trust. Knowing the difference between Medicare and Medicaid is on here. And that's covered community assessment, I believe. Yeah. So the community nurse needs to have an understanding of insurance practices. Who's eligible for Medicare? Who's eligible for Medicaid? What do they cover? Remember, as a community nurse, they turn to you for resources. You need to have your list of resources. You need to know where to be able to send people if they need insurance help, if they need pediatric help, if they need food bank, if they need rehabilitation. That's what the community nurse does. Okay. So that's your study guide. Anybody have any questions on that? Does most, if not all of this information, are you familiar with it? Melanie's shaking her head. Yes, that's good. Thank you, Melanie.
It's just stuff a good reminder too that I need to review more than I thought I needed to. But yeah, I remember it.
Okay, Barb. What are you thinking, Barb? I don't want to know, right? Is that what you're going to say? Okay, let's cover this document of previous HESIs because I want to kind of think about what questions we might be getting. Nope, it's not there. It's right here. Okay, so this document is specialty areas and topics for previous community HESIs. Okay, so as you see in the bottom, here's our sections. Most of what we just covered, we try to align them with the study guide: community, vulnerable populations, disaster, child development, elderly, and infectious disease. Okay, so here's some of the topics. This isn't an inclusive list at all, but here's some of the topics that we found that were covered on previous HESIs. So let's ignore all this at the beginning or the front part of this. We're just going to go to the end. Okay, because that's where the specific information is. So what we did in my last two classes, we tried to think about what kind of questions might be asked with regards to these topics. So this is the community section. So this is kind of the overall. So community assessment. Let's just go through all of them. We can then go back and decide on what questions. So there was questions on community assessment. There was questions on the nurse's role, assessing income, community clinic financing, trends and patterns, family eco map, voluntary agency, program goal setting, advisor role, outcome evaluation, risk findings, blood pressure screening, here's med surge, exercise, hydration. So what kind of questions are we thinking about some of these? My group Wednesday came up with, well, if you are a community nurse and you are doing a secondary intervention, so you're doing a community health screening for blood pressure, what do we need to know? Maybe what is a normal blood pressure? What's considered hypo or hyper? What else do you think could be asked? If the topic was blood pressure screening, healthy people, what do you think a question could be?
Would it be how they, or what the community, like, if that community is more hypertensive or something
Mhm.
because of like the diets and things, or I don't know.
Mhm. Yep, I
What
was
group is
thinking,
at risk for hypertension?
say that again, Quinn.
What group is at risk for hypertension?
Yep. There you go. Here on number 15, we're bringing in our med search knowledge. Well, with regards to exercise and hydration, what might you get with that? What kind of question?
Electrolyte imbalances.
Yep. Maybe signs of dehydration. How to educate about adequate exercise along with adequate hydration. That's what I thought about.
What fluid would you use?
Exactly. Yep. So these are topics. So you need to think about questions. What about this last one? Radiation exposure. What might they want us to know with regards to that? Maybe sources of radiation exposure? Maybe signs and symptoms of, I don't know. I haven't seen the questions.
Ways to prevent it?
Ways to prevent it. Yep.
Maybe tertiary for radiation exposure. Maybe we should find that somewhere in the book.
Yep.
I need
That
those.
if you do have an exposure, what's the plan? Right. So again, that's good. You need to think about these in terms of primary, secondary, and tertiary. And the nursing process. Okay. What about program goal setting? What do you think there? Maybe go ahead.
Sorry, I'm
No, go.
no one else is. I'm gonna take the advantage.
No,
of the time, but
this is meant to be a review and only a few people are participating, but there's nothing I can do about that. So go
from
ahead.
from what I have gotten tested on, even just on our exams in class, it seems to be that being able to identify at what stage, or like maybe it's asking you, like, she is in this part, what is she going to do next, or where is she at in the process, or what needs to be done still. So maybe going back through, which was what I wanted to ask when this was done, but that's later.
Oh, this was done. This was done last term. I presented this last term. So it's pretty recent. And these are pretty common topics that are covered. The other thing I was thinking about program goal setting is, I don't know, being presented a scenario, because a lot of what you're doing now, Kaplan, NCLEX, HESI, you're being presented scenarios, correct? And you have to be able to think through those scenarios. So
Yes.
let's say you're I don't know, I'm thinking about a question with program goal setting. They present a scenario of, here's where we're at in the program goal setting. Which part of the ADPI is this? I don't know. I'm just throwing that out there. What about family eco map? What might you get asked about that? First of all, nobody answered this during the review of the study guide. What's an eco map? You got to know this.
It's showing where the energy goes out of the house or family or person.
It's the social structure of that family within the community. Right. Now, I always like to use COVID as an example, and I bring it to myself. What was my social interactions, my social structure in the community prior to COVID? Well, I had a lot of things going on. Very engaged, very participatory in community things, family, let's say rec center, clubs, whatever. What happened to everybody's eco map when COVID came, when the pandemic hit?
Got cut off.
Absolutely got cut off. So my little
Reformulated.
Mhm. And what are some of the results we're seeing from everybody's eco map shrinking to little social structure, isolation, depression, a lot of new mental health issues, a lot of new addiction, substance abuse issues. Okay.
Communication and communication barriers.
Mhm. Yeah, isolation issues, absolutely. What do we think we might get asked about assessing income? First thing I thought about was community resources. Say, you have to be at a certain income before you qualify for whatever, Medicaid, or, maybe what is the poverty level? What do you guys think?
I think we have to know the poverty level, like the exact dollar amount.
No, I don't know. I have no idea. All I'm saying is we need to come up with what might they want to know about assessing income. Are we assessing income to see if you're at the poverty level? Are we assessing income to see if you qualify for certain programs? I don't know the answer to that. If you need to know, I'm just trying to talk through what questions might we get asked about assessing income. What about the nurse's role?
Probably,
Oh, go ahead, go.
probably the federal poverty income guidelines is probably relevant to us in that role.
I agree. So yeah, so that would probably be something I would want to know. I don't know if that's what the question is about, but as a community public health nurse, that would be something I would want to know. Okay. So that's the community section. Here's our vulnerable people category. Homelessness. Okay, so again, the front part of these are the sections, the topics. It's the last part we want to look at. So homelessness, cold exposure risk. What might be a question there? Maybe signs and symptoms of I don't know, frostbite, or
It would be at greatest risk for health related problems due to the cold.
excellent. Excellent. Maybe how to treat it. How to treat if they come into the clinic or the emergency room with cold exposure symptoms, how do you treat it? I'm just throwing that out there. Anybody else have any suggestions? How about migrant worker risks? What might we think about being asked with that?
Pesticide exposure,
Mm-hmm.
signs and symptoms, prevention.
Yep. And the one thing we covered with migrants, it definitely was the pesticide exposure. So I remember going through one of our primary, secondary, tertiary levels of prevention in that particular chapter, and it was directly related to pesticide exposure. Right? So what would be, let's just talk about that for a minute. So with regards to pesticide exposure, what would be a primary prevention strategy?
Hand washing stations.
Mm-hmm. What would be a secondary? Well, primary is going to be talking to this population about what the risks are of pesticide exposure. right? And then once we've identified that this is an at-risk population, then we put in our hand washing stations. And what else do we do? Early identification, early intervention. So hand washing would be a secondary, right? 'Cause we're
Secondary, you're right. Yeah.
secondary. And then what would the tertiary level be at? That they've already had that pesticide exposure and they're starting to show symptoms, right? So then we have to treat them as they have had pesticide exposure. Make sense? What might you get asked about community resources in the rural in the rural area down here? Anybody? Maybe, is there a lack of community resources?
Right.
Or,
The community that's not going to seek help, not going to have any kind of preventative measures like seatbelts or helmets necessarily.
Yep.
They're going to have a higher incidence of abuse and they're not going to talk about it.
Mhm.
This is where the nurses are going to kind of wear all the hats, like we just said.
Yeah. Hang on one sec. I'm just going to mute myself because this is Dr. Lundy calling me. 1 second. Okay, sorry. She was responding to Dr. Apple's review. Okay, let's go back. Okay, so we were talking about community resources. Quinn, agree with everything you say. I might also add a possibility of what is the downside to having less community resources? Right, because we know in the rural community, there are definitely less community resources. Here's cultural Hispanic. So obviously there was questions, I don't know, about the Hispanic culture. I don't know if that was language or space or presentation of conversation, and also Islamic faith. So you need to go back to that chapter and review, or go back to the PowerPoint and review certain cultural characteristics with those two cultures. Okay. Another topic, culturally sensitive teaching. That's in your cultural competence area. Okay. Battering communication. What do we think that's about? I think that's about being able to identify signs and symptoms of potential abuse. What do you guys think?
Question about that. So
Mhm.
when you hear of somebody, or when you suspect it and say it's an adult, if they deny it, but you're pretty sure of it, what can you do? Anything?
Well, remember that you're a mandated reporter.
Uh-huh.
And so if you suspect something is going on, you need to report it. And then
Even when it's adult to adult, like I wasn't sure how that works.
yeah, definitely adult to adult, sure.
Okay.
If you have reason to believe that there is abuse going on, it has to be reported.
Okay.
So I guess in number 9, what I'm thinking about is what would be maybe giving you a scenario of what would be the symptoms of an abusive relationship. Let's say they show up to the ER. What are we looking at for signs of battering communication? What do you guys remember?
Not
Or
letting
a
the
spouse
spouse,
who won't leave them alone or won't leave the room,
Mhm.
won't let them talk for themselves,
Won't let 'em
or
talk. Yep.
yeah.
Anybody else want to add to that?
not having an answer for injuries or not having answers that make sense. Having bruises healing in different stages.
I agree. Number 10, home health dying client. What did we talk about when we talked about the hospice nurse working with families of a dying client? We talked, and this is my take, we talked about one of the goals would be to have everybody engaged in the process with their family member. And what did we talk about? We talked about that those family members that are not engaged, right? So maybe they're asking what would be some strategies that the home health or hospice nurse could use with families that are not engaged. Do you remember that part of our learning during the term?
Yes.
What do you guys think? Maybe how do we treat our dying client with dignity and respect? What do you guys think?
Caregiver role strain,
What?
identifying caregiver role strain and intervening before abuse or
Excellent. Yep.
Are there ever any like this therapeutic communication with family members who don't agree with the situation?
Absolutely.
Because I mean, I've seen it in real life where there's all the family and the client, they're all understanding, but then, the sister or the daughter from out of state isn't, on how to deal with that, or I don't know, something.
Yeah, that's exactly what I'm talking about. Is how does the hospice nurse manage all the group dynamics during this process? That's what I would think. Maybe a question about that is how do you help that not engaged family member to become engaged, because the goal is to have everybody engaged in the process. Is that what you're talking about, CJ?
Yes. Yeah.
Let's see. Nursing skill, nutrition, geriatric home nutrition. What do we think that might cover?
I don't know where it came up, but it was the Meals on Wheels, and I still need I still need it to be explained to me why Meals on Wheels was a greater priority than having a home health aide in that scenario.
Okay, that's going to come up. So let's talk about it when we get there. Okay.
Was it,
Then, oh, go ahead.
it's fine, never mind.
No, go ahead.
That's the question, is because it was geriatric and then nutrition. So I'm thinking the Meals on Wheels, but that was
Yeah.
the priority.
It's going
But
to come up here. It's going to come up down here. Where are we? It's going to come up when we get to our geriatric. Where is it? Here it is, right here. Number 27, right here. So we'll get to that. Okay. Disaster. Okay. Doesn't have that many, but natural disaster preparedness. What might we get asked there? Maybe what are the 4 stages of disaster? Preparedness, prevention, preparedness, response, and recovery. Okay. Number 4 would be, why do we think cholera comes up? Is that pretty common after disasters? And why? Lots of bacteria, dirty water. What do you guys think?
That would be like, for instance, after Katrina with all the stagnant water and all that.
Yep. So this came up in previous HESIs. So what I'm thinking is that that's a pretty common infectious kind of communicable disease after a disaster. So we should know that. And then disaster red tag triage. Do you guys, in your review of disaster, this would be in the response section, know your tags. What do they mean? What does a yellow tag mean? What does a green tag mean? What does a red tag mean? Okay. Child development. Here's some other areas that came up within this topic. Screening programs. What might you get asked about screening programs? Maybe what's important, what kind of screening programs should be in place for school-age kids, for adolescents, and then diet and stress. Maybe that's talking about obesity, how to reduce, I don't know, I'm just throwing this out there. With the importance of a healthy diet, importance of reduced stress levels, heart healthy diet. What do we do as far as teaching, pre-adolescent teaching, health teaching? That's right back in our HESI study guide. Going through the first section of populations throughout the lifespan. Healthy People 2020 on adolescents, that came up. Seatbelt safety came up. What might we get asked about neighborhood safe houses? What's important about those? Okay, I'm just going to keep moving through. Teaching, nicotine. That's, why would that be important? Lice screening. Teaching about skin health. Scoliosis screening. Why is that important? What might you get asked about scoliosis screening?
What age group is that
Or
most?
a child comes in, what would you see? Maybe their skirt's not equal or whatever, all those things they said, you know, they try to bend over.
Yep.
Or they don't want to wear their brace because they're embarrassed about it. What can you do?
How many hours a day do they have to wear the brace?
Yep, exactly. What's the right age group to screen? Yep. And then ADHD in the schools. I don't know. What would be, if you observe a student to have these types of behaviors, is that indicative of ADHD? Treatments. How does a school nurse respond to a parent? How do you have that conversation with a parent about observations? I'm just throwing things out there. Teaching. This is number 19, eczema in the school. Go back to your HESI study review. That's in the school child teaching section. Okay, what about immunizations? What might you, school nurse immunizations? What might you get asked about immunizations? Kind of a big deal with school age kids.
MMR.
Yep. I don't know that you necessarily have to know the immunizations, but overall, do kids require immunizations before entering school? If they're not immunized, what do you do? We talked about that or in class of, yes, it's, most kids are immunized, but for the kids who are not, what do you do? How do you protect them? What if there's a outbreak in the school of, say, pertussis, and they're not immunized? What do we tell the parents? How do we communicate? We talked about that in class. There must have been a question or something about the hepatovax B allergy, and what does an allergic reaction look like? So we have that in here. And how do you conjunctivitis assessment? I think pink eye when I think about that. We're in the child development. How do you assess conjunctivitis? What do you do? Is it contagious? Can it be passed along? Okay. And then family assistance with ophthalmic medications. I don't know. I think of a question, maybe, what if they can't afford it? What resources do you have in the community that could help them? And then lead poisoning. What might you get asked about lead poisoning and the prevalence of it?
I'd say like the risks, or the
Mhm.
family lives in they'll give you a scenario. Family, this is what's going on. What would be a concern for the community nurse? I don't know,
Yeah,
something like that.
and your assessment, your environmental health assessment, right? How long have they been living in the home? Are they planning on doing remodeling? It's,
How they
to,
dust or whatever, all those little, I know there
Yeah.
was something about, I'm trying to think exactly right now, but something about if they dust, it's not safe, but they need to use wet,
Mhm.
something like that. I don't know.
Thank you. What are the signs and symptoms of lead poisoning? So how do you educate? Think of primary. How do you educate the families on, let's say they're doing remodeling. How do you educate them on not using lead-based paint, right? Or if families live in older homes, if you're doing early identification of, making sure that they understand that they potentially have, lead-based paint. Early identification, early screening, and then your tertiary is they do actually have lead poisoning. They show up with signs and symptoms, GI symptoms. What do you do? Okay. So again, we're just talking through this. All I can provide you is topics. So we're just talking through of these topics. What do we think they might ask? So I hope this is helpful. Okay, we're in our geriatrics topic. So elder health assessment. What do you guys think? What entails a elder health assessment? What do we look for? What risks do we look for? What are they at risk for? What kind of abuse? Physical, psychological, financial? What do you guys think?
It's such a wide thing. It could be
I
almost
know.
anything. But
I
I mean,
know.
you just, I think they're pretty straightforward if you can just think of those, the main thing, like their financial abuse, or they're off in a corner, physical abuse, or seclusion.
Mm.
But the assessments would probably, the big one is the skin assessment, because they're so prone to breakdown, or nutrition. Those are probably the most common I see ever.
Mm-hmm. Yep. Yep. And along those lines, if you're doing an elderly health assessment, you come upon A, B, C, D, what's the risk? So, I mean, that's a big one. That's a big, that could entail a lot of different questions. What about community senior health screening? And maybe what kinds of screening are most appropriate for this population. Skin health, teaching skin health, number 5. Home environment safety. Yeah, that's where we talked about having non-slip rugs, having furniture moved out of the way so we prevent risk of falls. Okay, home care referrals. Again, comes up family assistance with ophthalmic meds. That could be a resource question. Do you have the funds available to purchase, or do we need to get you some resources in the community? Parkinson's home care, orthostatic. What's orthostatic hypotension? How do we assess for that? And what teaching might we do around that? Okay. Here's your med surge, cardiovascular, hypertension, endocrine, your lipid screening. So again, I'm just going through some topics that have come up. What do we talk about? Remember in class number
What's the-
20? Oh, go ahead.
I was just gonna, just back one, what's the, there was a vaccine. I was wondering what that is. I don't remember.
Flu vaccine?
Oh, is that what, no, the next one down, the Menomuni? What is
Oh.
that? Number
Oh.
20.
Oh yeah, I do not know. Can somebody look that up for us?
MENO, yeah, I'll look it up. You can go on.
20
I was just looking. Yeah, curious. I'll look it up.
21, assignments in home care. What do you think that? I have an idea of what that might be. What do you guys think about that?
Like which patient you should see first that day?
Possibly. I think of the safety. You know, when you have your assignments in home care and you're going house to house, what are the safety tips? What are the personal safety tips that you want to keep in mind when doing home visits? That's what I think about. But you're right. It could be, how do you prioritize who you see? Do you remember what we talked about? Number 22 with elderly relocation, and what are normal reactions and what are kind of they're not coping well with the relocation. You guys remember that discussion? It was, I think, the elderly client that was moving in with their younger kids, and what was going to be typical reactions, like having to change doctors and what else was it? Having to change daily routines, those kinds of things. Okay, Meals on Wheels. So, Alex, are you here?
Yeah, I'm here.
So what was your question on Meals on Wheels? Was that you?
Yes, but it's all right.
What do you mean?
I was able to find where I found the question and like read the rationale.
So why don't you share with the group about that?
I mean, making sure that they have food consistently is like Maslow, so.
Okay. Okay. So with regards to Meals on Wheels, what question might you get asked? Or what would be a potential question you might get asked about that? Alex, why don't you give us your thoughts on that? Maybe what is a community resource that provides, that ensures adequate nutrition, or for the elderly population that can't get out and do their shopping? What do you guys think?
Yeah, I was thinking like a list that would give you some kind of scenario, and then what would the community health nurse suggest or give us as resources to the paid client.
Exactly. Let's say a client was homebound. What resources are available, might be available, that the nurse could provide a homebound family or homebound client or homebound couple?
Or
Yeah, that's one of those that could be like a select all apply or something too. Sorry.
Exactly. Yep.
Right.
Yep. Go ahead. Who else was going to say something?
A nurse does a home visit and realize that the elderly is not able to provide or
Exactly.
make their meal anymore, what would be one of the resources the nurse would provide?
Exactly. Excellent. Excellent. That's how we need to be thinking through this. Yes. Nurse goes in and does her home assessment and realizes that they're not able to provide that service for themselves anymore. So what do we need to do? Diets. Let's see what else was in here. Morbidity data gather. What do we think of that with this population? You know, what contributes, what factors contribute, right, to the increased morbidity? What data do we need to gather to identify that? Teaching elders about healthy diets. Primary prevention, cancer. What kind of question might you get about that?
Teaching about the need for self-breast exams.
Right.
Correct. Yep. The importance of follow-up, the importance of annual screenings. Yep. Okay, and then the last section was infectious diseases. So here's a few topics that came up. Newborn, vertical transmission. What are we talking about there?
Spreading something from mother to baby.
Which is called what? Transplacental transmission, correct?
Yes.
And why is that important? And maybe what STDs do travel transplacentally? And what was the one STD that we talked about?
HIV.
Syphilis.
Thank you. Yes, Pauline, thank you. Yep, syphilis. Remember we did the section that was on one of your study guides for your exam, that the importance of why it's so important to screen for STDs with pregnant patients, because if something, remember we talked about STDs can either be bacterial or viral, and bacterial we can treat, but viral we can't. And if syphilis is transmitted through the placenta and it's not identified, the potential significant impacts to the newborn, or the neonate and the baby fetus and the newborn. You guys remember talking about that?
Yes.
Vector-borne diseases, what's that?
From mosquitoes.
Ticks. What are some maybe what identify what are vector-borne diseases, or maybe you have a tick bite, what are the signs and symptoms of Lyme disease? I'm just throwing different types of questions out there. And here's our CDC reportable diseases. I don't know that you need to know what the reportable diseases are, only that there are certain ones that need to be reported. Right? That potentially have large community impacts if they're not. Okay, anthrax incubation. What does that look like? I know I didn't specifically go over that in class, but that was in our chapter, and there were other things. It was the there were other different bioterroristic agents that the chapter went through. I think that was actually a box in the chapter of different kinds of agents. So here they're asking, what specifically is the anthrax incubation? Okay, and same with SARS. Again, we're bringing a lot of med surg stuff in here. Reproductive, pelvic inflammatory disease. What's the risk factors for those? And then your epidemiological triangle. Maybe they could ask what are the three components of the triangle? Agent, host, environment, or what do you think they could ask? How they interact? What are the three agents? What's an example of an agent? What's an example of a host? Back in your HESI study guide, there's a visual, there's a picture of what each of those three could be. All right, remember, you need an agent, which is the disease, which is the bacteria, virus to infect a host, which is you and I. And then depending on what's going on in the environment, internal, external factors affect how that agent and host are going to interact. Do you have let's take COVID, for example. You have a COVID outbreak, and how is it going to affect the elderly? How is it going to affect the younger kids? What's your immune status? All those, are you healthy? Are you compromised? Do you have comorbidities? All those factor into how it will look. Then the importance of flu vaccines as a priority. And then here's your TB, 12 and 13, your couple of pieces of information about TB. What questions might we get about TB skin test follow-up, TB screening, X-ray? What do you guys think? There's a whole page in your HESI study review on TB, so I would be reviewing that as well. That's it for that. So anyway, helpful? Is this helpful? I'd like to hear from people.
Yes, yes.
Yeah, I like going through and kind of just critically thinking about what kind of things I could be seeing and what scenario stuff.
Exactly. And that's the hope. And then providing you some historical perspective on what's been seen, what topics have been seen, for you to actually see that. You can kind of
Well, and
think
that
about
too helps hone in on what to study, because I've always have a hard time on what to focus. Like, yeah, I have the exam reviews, but if there's something I should focus on,
Yeah.
knowing what kind of questions there's been is helpful.
Exactly. And I appreciate, let's see, CJ and Quinn and where's Alex? Appreciate your participation. I hope others are listening and just kind of taking everything in, but overall feedback from others? Helpful information, helpful to go through it like this? Are you less threatened by the huge study guide? Does it make more sense now? What do you guys think? I'd really appreciate some feedback.
Yes, it's less overwhelming now.
Pardon me?
Sorry, my internet's not very good.
That's okay. You
And
say
yeah,
it's
it's less overwhelming.
okay. That's my goal. Anybody else?
I wasn't really overwhelmed by the study guide. It's just helpful to kind of know what to study, just because I have like literally like 10 piles of things in front of me, like that I've been, studying and whatnot, but it's just nice to know like where to focus.
Yeah.
That's, yeah, I'm very, I need to hear it. I have a hard time reading.
Okay.
I don't remember it. I have to read out loud and then I have to hear it. So that's how I learn it. So I read everything out loud and then I need somebody to verbalize it back to me.
Okay.
And that's how I learn things.
So was this review helpful for you, Barb?
Yeah. The
Good.
review helps because you're saying it
Mhm.
and it's, it for me, just saying it without like the interruptions
Mhm.
helps,
Okay. 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 Do you want to go through,
Shows me,
pardon,
like
say that
things
again?
things that I was afraid that I didn't remember, going over it like this, it's sort of like, oh yeah, you know this. Like,
I'm
yeah,
sorry.
you know some of these stuff. Don't be afraid.
Right.
So
Right.
that's where I'm at with that.
That's good. That's
I
good.
think it was very helpful.
Good. Good. Okay. Do you want to go through, we have a couple of minutes left. Do you want to go through a couple of Jeopardy questions? Or have we had enough?
Yeah.
Yes.
Oh, okay. 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 You guys see my screen? Okay, just
Yes.
throw out your answers. Just see. What do you guys think this is? This is kind of a hard one. I'm going to give you this. But I'm not going to give you this one. You guys should know this one.
Oh, I'm worse at this than I thought.
Yeah, that's why. Yeah, this is really kind of a big picture overview.
I know it's I
And I
like
don't-
watching Jeopardy, but trying to think of it backwards. I always had a problem like getting the answer and then giving the question or whatever.
Actually, my last two groups were getting frustrated because they weren't getting the answers right and it was overwhelming them. And so we stopped.
Oh, sad.
Because this was much different than the other two documents we had covered. But this question, what's this question? Beliefs, values, assumptions about life. Right? This is culture.
Oh.
Right? What is culture? Okay. How about this one? What's just think of the definition. What's the process determines the probability that something's going to happen.
What is assessment?
No.
Oh.
The probability that something's going to happen. We're doing this all day, every day.
Fiction.
We're taking risks. Right? The process determines the probability of the health threat associated with the exposure. Again, I don't want to overwhelm you guys. because I think we've done good up to this point. This is just thrown out a couple of big picture questions. Practice involves defining, so this is really defining our profession, defining nursing credentials, distinguishing nurses amongst other
What
healthcare
is
professionals.
like what is a healthcare role or what? I don't know.
Scope of practice,
Oh, scope of yeah. Okay.
right?
Yeah. What is primary prevention?
Mm,
Isn't that the first one?
yes, but we have identified
Courage.
a group, right, who potentially would need some community resources such as WIC, so early identification, early intervention.
Oh, so it's secondary.
Secondary,
Why is it secondary? If you don't mind me asking.
because we have identified a group, a population group who is pregnant, right, to participate in the prenatal care in the WIC program. So we have identified this population as a potential group that might need additional resources. So we're screening. Some of them may need it, some of them may not need it, but we've identified a potential high-risk group.
Okay.
Does that make sense?
Yeah, I was just always kind of thinking that primary could fall there if it wasn't, because I thought primary was like early detection of a problem that happened, but so I don't know where the line would be, I guess is what my
So I
question.
think the primary would be
When we don't know who the
correct,
group is.
Oh, okay.
or teaching, maybe teaching teaching this group, this population about healthy nutrition, teaching them
Oh, okay.
about it, why it's important, right? But if they're identified after they've been identified as a potential high-risk group, then we might have some resources that could help them to prevent,
So
hopefully.
even if they're a potential high risk group, that turns to secondary.
Yeah, because
Oh,
it's,
okay.
remember, early identification,
Yeah.
early intervention.
Okay.
Yep. Does that make sense?
Yep.
Okay. You want to keep going? I'm going to skip to this one. I don't like the other one. This is kind of a wordy one. When you hear the answer, you're just going to kind of go, ugh. But there is one word in here that's key.
What is evidence-based or best practice?
Yes, exactly. Exactly.
Yeah.
Does that all make sense? Does that make sense?
Public health endeavor in which there is an informed, explicit, and just.
Yeah, if they took out judicious, I'd be doing better because I barely know what that word means.
Yeah, yeah. This is a good question. Think of your ADPI here. Let's just go right to the answer so we can.
What is the diagnosis? Oh.
So, no, that was not what I wanted. Hang on, right here. Right, does that look like your ADPI? Remember the question. Developing, what are the steps in developing an education program? Identify what the problem is, right? Select what you're going to be doing, what theory, what strategies you're going to use, right? Design, implement, evaluate. I
So
like
this
this next.
could be like a select all and apply.
Could be,
But we could look at this as a select all apply one.
you could,
And
or
this,
you could be presented a scenario that says, this is what we're doing right now. What part of the developmental program is it in? Is it in the assessment phase, the planning phase, evaluation phase?
okay. Okay,
Makes sense?
yes.
I like this question. We talked about this earlier. What are the skills of an effective educator? Okay, think about it. Think about if you're going to be doing a program this weekend, you've developed an education program for first-time moms. What things do you need to consider? Okay, and why is this population different from others? What are they, a younger group, an older group? Okay, what makes you an effective educator?
But they also have to be ready to learn.
What if they're not?
You got to figure out a way to gain their attention.
Attention.
Them in.
I mean, that's like the first thing.
Yep.
They, we have to gain their attention. That goes right there. They have to be ready to learn.
Mhm. What if you have some in the group that, let's say this is one of our very high risk groups, which are teen pregnant moms. How do we engage them in teaching them the risks of doing drugs during pregnancy, the importance of healthy nutrition, the importance of following up with their prenatal care? I mean, that's a pretty tall order with a lot of potential barriers. What's going to make you an effective educator to teach that group?
They figure out what the barrier is for that person and try to maybe teach why it's important specifically to that barrier. Maybe you can get through.
Mhm. Mhm. I mean, so much of what we do in community and public health is education. What happens if you're teaching a group of elderly clients that may be visually or auditorily impaired? What do you do? What could you do? What were some of the strategies and suggestions we talked about? Maybe for the hearing impaired, maybe we use more poster boards, more visuals. Right? These are the things you need to think about of who's our audience? How are we going to get to them? What potentially are the barriers? Those are the things that we have to think about. This should be pretty easy.
What is community? Oh, yeah. So I was going to say, actually.
Did you have that right?
Yeah, for once.
Okay. Well, that's why I don't want to go through too much more, because this is just a little bit more than people can handle at the end of 2 hours. And if you get them wrong or you can't get them, I don't want you to get frustrated. Does that make sense? I'd rather hone in on what we did earlier, which is very targeted, very specific, and very focused review. Okay. Let's see, going through. Okay, this is a good one. What are some issues you might face?
Lack of, like, if insurance won't provide something that somebody needs, or
Mm.
that people, there's all kinds of things with case management.
Yep. And here's the two biggest issues we talk about: legal issues, ethical
Mhm.
issues.
Yep.
Okay. Okay, what are they?
Prevention or preparedness.
Yep.
Oh my gosh.
Response
Response.
Recovery.
and recovery.
Mm.
Prevention, preparedness, response, and
Yep.
Primary.
Everybody agree? Primary?
yes, primary.
What is lifestyle? Or I don't know.
It's in the ballpark. What I mean, if you have lots of factors, let's say you're homeless, let's say you're,
Susceptibility. Susceptible.
okay. Susceptible is part of it, but what happens if you're homeless, or you are teen pregnant, or you have significant mental illness? What are you considered?
Vulnerable.
At
Vulnerable
risk.
population.
Mm.
Vulnerability.
Make sense?
Yep.
Rural healthcare delivery issues, barriers to care. Let's just look at them. Right? We've talked about this: lack of healthcare providers and services. Transportation, big issue. Many of the rural population families live in poverty, so they may not be able to pay for their care or have insurance. Language. And then all those different culturally sensitive things that we need to consider. Okay. This is good, because I think that goes back to our poverty, assessing poverty. So what do you think is issued by HHS, used to determine whether a person or family is eligible for public assistance?
Already guidelines.
The federal, yeah.
Okay, so back to Quinn. I think Quinn said, well, do we need to know the amount? I don't think so, but I think you would need to know the answer to this question. What are they used to determine it? Right, because it may look different in every state.
That's true. That's a good point. I think it might be different every state.
Yeah.
It's different in every state. It's different all over.
Right. So maybe knowing what is the determining factor. Well, it's the federal income poverty guidelines.
And every county has,
Exactly.
every county even gives more
Mhm.
money to this county's people, get more money than that county's people. This county gives more services than that county. It really depends
Exactly.
on how many people are in
Right.
that county that are on services than another county. Because
And
I
what
work
if-
trans counties,
Yeah.
and you know, like Portage County, people get more than Summit County does, because Summit County has more people that get services than Portage County does.
Well, I think you have to look at the demographics of the community and
Right.
right. So there's a lot of determining factors, you know, a rural community versus an urban community.
Right.
So I think this would probably be, if Quinn's still on this, I can't, I can only see a few people because I'm
Yeah, I'm
sharing my
here.
screen.
here.
I think this would be the answer to your question. Not so much what's the amount, but what is it? What's the, what is the
Like the determining factor.
determining factor? Yep. Across, you know, federally, what does everybody use? It may look different, the amount, but this is what they use. I like this question.
Tertiary,
Why?
severe and persistent mental illness is already the diagnosis. So we just want to lessen the effects of it.
Excellent. Excellent.
Sorry, I stepped away for probably 10 minutes.
That's okay. We're just
This one was a good one.
this is a good one.
Substance abuse. What is substance abuse? Because the
Anybody?
keyword wasn't chronic. If it were chronic, it would be like a Healthy People 2020,
Mhm,
pulling from that instead.
mhm. And if it were chronic, it might be the elderly population, or remember that question on your exam of what's the most significant health risks in the elderly population? It's the chronic diseases, because why? People are living longer, right? Due to technology, pharmaceuticals, healthcare. Okay, but this is, so the answer, everybody want to go with substance abuse?
Absolutely.
Absolutely.
Absolutely. Complete.
That is just our society nowadays.
Yep. This threw everybody off, and I think all you have to, if you had added one word into this question, I think it would have been obvious, but this is, the answer is faith community. So I think what you need to add is the nurse addresses the universal health problems, individuals, because you could say, well, all nurses do this. You know, if you had said from a spiritual perspective, right? Because that's one of the big factors for faith-based community nursing is, yes, they address holistic, universal health problems, but they also, the difference is that they bring in the spiritual aspect of it. So I don't like that question. And remember, these are, when you read this question, these are clients that cannot get out. They
Home
are
health nurse.
Mhm. Well, home health, but what kind of a home health? Remember the different kinds? There was, here's your answer, just to, so we're not, primary care, right? You're having to go out, yes, you're home health nurse, but you're home-based primary care because they can't get to the clinic, they can't get to the office. I think this is too vague as well. Kind of like the faith community nurse. If I added in there that,
Is this a school nurse?
yeah, the answer is the school nurse. Why did you think that? What gave it away?
Well, I've been a school nurse, so I feel like I've been all of those roles.
And me as well. Exactly. But this doesn't jump out as school nurse. This is kind of like the faith community where, well, we all do that all the time in whatever setting we're in. right? So I think that this is too general as well. If healthy was substitute for work environment, what would the answer be?
Occupational nurse.
Exactly. Exactly. Right? So you got, what is occupational nursing? Work environments. Right? Okay, let's go down to here. Okay, do we know what the 3 stages are? What happens at the beginning? Well, let's just talk about this for a minute. Here's your answer. Right, we start as maybe culturally incompetent. And as we learn and grow and make an effort to learn about different cultures, we become culturally sensitive. And that's an ongoing process to the end goal of being culturally competent.
Which the difference between sensitive and competent is
Well,
that sensitive is that you are aware that people have different perspectives, and competent is you understand what those perspectives are.
Right, and you're working towards number 3. You know, you start out being incompetent. So I always use the example, well, I used the example of a couple of years ago in the schools when I took over a new school, and part of the community was very, a portion of the community and the kids that came were of Hungarian culture. I knew nothing about their culture. So I was starting out the school year completely culturally incompetent. But through all the activities that are suggested of how to become competent, right? Aware, participatory in their culture, actively learning about it. I spent several months becoming culturally sensitive to their culture. And by the end of the year, I felt like I was culturally competent with this group.
But somebody who is like, would that be considered culturally incompetent though? Because to me, I feel like it would be culturally sensitive, even because you're aware that their lifestyles or things may be different, and you're trying to like,
well,
isn't that what sensitive would be?
Yes, but the question was, how do you develop it? So you have to
develop.
think,
Okay,
how do you think of it? You have to think of a starting point.
I see. Yeah.
So in my development at the beginning, I was culturally incompetent, not through any fault of my own. It was.
Yeah, that makes sense.
Does that make sense?
Yeah, I was just thinking, I was like, well, you weren't trying to be like incompetent, or you weren't a person who just doesn't care.
No,
you know,
but
or-
based on the situation I was presented with, I was incompetent at the beginning, but then did all of what we're supposed to do to become sensitive, learning, and then obviously the end result was to be culturally competent, which I did. So
yeah.
does that make sense?
Yep.
Okay. All right, so that's it. So you guys did good. Actually, you guys did better than my other couple of groups. So, but I just didn't want wrong answers to take you back to, oh my God, I don't know it. That's,
Well, thanks for
anyway.
walking us through that. Appreciate it.
Yeah. Helpful,
Yep.
you guys. Okay.
I like thinking of it a different way. It was kind of hard because it's thinking of it backwards. If I could think of all of them backwards, I'd be able to know all of it really well. But it's actually good to have to think that way. Have to think different.
Yeah, and I want you guys to think when we hear a topic or see a topic, what might be asked. Like if you go back to the HESI study guide and it talks about let's see, let's see, go back to the HESI study guide, and I'm at the beginning, and it talks about populations, right? And you think, okay, what might they ask me about infants? Well, here's something right here that the number one cause of injury or death is suffocation,
Mhm.
right? And you go into children, what are issues with kids? Well, obesity is one. Injury and accidents are one. So you might get a question that says, what's the number one cause of death in ages 1 through 24? Motor vehicle accidents, right? Toddlers. What are the risks for toddlers? Falls, poisonings. Okay. So that's the way I want you to think backwards. Okay. Now I have the topic. What might I be asked? So hone in on these study guides. Oops. All right, you
Will do.
guys.
Thank you so much. Appreciate it.
Does that help? Oh, stop share. Okay. All right. That's all I have. Good luck in the HESIs.
Thank you so
Reach-
much.
Thank
You're
you.
welcome. Reach
Thank
out.
you.
You're welcome. Reach out if you need anything.
All right, thank you.
Okay.